Welcome back.
Well, South Africa only has 975 registered psychiatrists serving a population of 60 million people. That works out to only one psychiatrist for every 61,000 people. Mental health professionals are calling for greater collaboration between Western medical specialists and African traditional healers. According to the South African Society of Psychiatrists, 1 in every 3 people experiences common mental health disorders like anxiety, but 75% go completely untreated. World Mental Health Day is on Sunday, and the fitting theme for this is mental health in an unequal world. SASOP member Dr. Lerato Dikobe-Kalane joins us now to explain what this kind of collaboration could look like. Doctor, thank you so much for your time. I know the role of traditional healers in treating mental health has been discussed and debated. I'm not sure there's consensus, though. What's your take on the role that traditional healers could play in treating mental health?
Thank you for having me this morning. Indeed, we need to start collaborating more with our traditional and faith healing colleagues in order to bring mental health closer to the people, especially those that are in need the most in the rural areas and some of the suburban areas.
Why do you think the traditional healers in particular have an important role to play?
Because of the numbers that they have. We have over 200,000 traditional and faith healers in South Africa. And because they are so important and so valued and trusted in the communities in which they are situated, people would rather go and see them before they go to a clinic. Because of the importance that they play in their communities, they are very influential and people really do trust them. So I think if we could just collaborate better, we could beat the scourge of mental illness.
Mental health encompasses a lot. There's your more common type of disorders, anxiety, depression, and then there's serious mental issues, bipolar disorder, psychosis. Where does traditional health fit into treating these disorders?
In papers that have been published in the past, it has been shown that for the more serious mental illnesses like bipolar disorder and psychosis, traditional medicine doesn't really have much of an impact. But when we're talking about the more common conditions like the mild depressive episodes, the anxiety disorders, there traditional healers can really help.
I've grown up in an African household, and a lot of the times mental health was dismissed. It wasn't a thing that was spoken about. It was either you're crazy or you're possessed or it's the ancestors speaking to you. What is the uptake of disorders like bipolar and anxiety and depression amongst the traditional healing community? Is it something that they acknowledge and are able to diagnose?
I think it goes both ways, between Western and traditional practitioners. We first need to respect each other's trade and know which lane we belong in. So if somebody walks into my office and they have an affliction that is more spiritual, they know who it's an issue of amadlozi, I need to respect that patient's culture enough to say, okay, my brother or my sister, this is beyond my scope of practice. You need to then go and see the appropriate traditional or faith healer. And the same way when a patient who is floridly psychotic goes into the consulting room of a traditional or faith healer, that colleague has to be able to be honest enough to say, this is beyond my scope of practice. Please go to your nearest clinic or your mental health care provider. Once that has been sorted out, then you can come back and we can deal with the amadlozi.
So essentially, it's an exchange of knowledge between the two bodies. It's Western healers or Western practitioners accepting the traditional side of things and traditional healers accepting some of the Western medicine.
Most definitely.
All right. So where does the collaboration start and how can we see more of it?
platforms like this that we're having this morning, it is sparking interest in a lot of people. We need to start holding, small workshops in different communities where the local Western mental health providers get to meet the local traditional providers. And then people start talking. It really starts with conversation. We need to start communicating more and respecting each other as practitioners.
The respect issue, I think, is one of the major barriers. If you are a traditional healer and you don't have a medical degree from Wits University, you might be looked down upon or not taken seriously. How do we overcome that?
Very true. I think we need to start getting off our high horses. It doesn't mean that if you've got a degree from whatever university, you are better than another practitioner. No form of medicine is better than the other. Each one, alternative and Western, has a place to, has a position in the health sector. And we all go through our different training. I went through an academic training. My traditional or faith healing counterpart went through a spiritual training, and we need to be respectful of that.
All right. Dr. Dikobe-Kalane, thank you so much for joining us. Dr. Lerato Dikobe-Kalane of the South African Society of Psychiatrists, talking about the role that traditional healers can play in tackling mental health. And there's a big gap. There's a big gap when it comes to mental health. Way more people than there are psychiatrists. And so she's saying, and a lot of people have said, traditional healers can play a part. Yeah.
I think a lot of people, because of stigma of mental health issues, would rather go to a traditional healer probably than a psychiatrist. And so if the two could meet, it would really be a wonderful meeting of skills and minds. And as the doctor said there, for issues such as anxiety and, therapeutic issues, traditional healers already playing a very crucial role, but that needs to be, if combined with a psychiatrist, it could be improved even more.
All right. She has said that psychotherapy is one thing where traditional healers can definitely play a part. And one of the reasons that people go to traditional healers more is because they understand their culture. And so if we can get more of the Western medicine practitioners to understand culture and tradition, it would go a long way in making that intersection bigger. All right, we're going to speak about